I'm going to be your student nurse today. First, I'm just going to provide you some privacy. I'm going to do some hand hygiene. And then can I get you to verify your name and date of birth for me?
Emily Myers, 9/4/2002.
Great. Okay. So the doctor has ordered a head-to-toe assessment today. So do you have any questions about that?
No.
Okay. We're going to go ahead and get started. If you would just sit up for me. I'm just going to palpate your scalp. Will you tell me if you have any tenderness there?
No.
While I'm here, I'm going to assess that the scalp is in good condition and that the hair is evenly distributed. Okay, now I'm just going to assess your ears. Everything looks symmetrical. Can you tell me if you hear this?
Yes.
And on this side?
Yes.
Alright, great. And now I'm going to assess your eyes. I'm just going to shine some light in there. First, I'm going to measure the size of your pupils. Okay, they look to be about 5 millimeters. And now I'm just going to shine some light. If you could just look right in for me. Okay, so everything looks good there. When I shine light into your eyes, they accommodate to the light. So that just means that when you shine light into one eye, it decreases in size significantly, and the other eye does as well, but not as much. Now I'm just gonna check for accommodation. So if you would just look at the pin light for me, I'm gonna hold it away from your face, and then we're just gonna make sure your eyes can focus. Okay. So do you wear any contact lenses or any corrective lenses?
Yes.
You do? What do you wear?
Contacts.
Okay, and when was your last eye exam?
Last month.
Okay, great. Alright, and so now we're just going to assess the nose. Everything looks good and even. If you could hold one side of your nose and breathe in and out. Okay, and the other side. Did you notice any difference?
No.
Great, okay. Now we're just going to assess your mouth. Open wide, say ah. Alright, the mucosa looks good and pink. Teeth are intact. Everything's well. If you could you swallow for me? Okay, do you have any trouble with your teeth?
No.
Okay, do you have any trouble with your throat? Any pain in swallowing, swelling,
No.
anything like that? Do you have any sinus problems?
No.
Okay, and with your ears, have you noticed any excess wax or anything like that?
No.
Okay, great. So now if you could just lean back at about a 45-degree angle, which will be right there. Okay, and if you'll look to the left, like turn your head, thank you. And then look to the right. Alright, so I was just checking for jugular vein distension. That's just making sure you don't have any heart failure. If you do, your jugular vein would distend when you turn your neck. So now if you could just sit up for me. So now I'm just gonna listen to all of your heart sounds. Is that okay with you?
Yes.
Alright. I'm gonna tell you where I am. First I'm gonna listen with the diaphragm and then with the bell. So we do go down to the second intercostal space. The apical. Erb's point. Tricuspid valves. And your mitral valves. Okay, I didn't hear any adventitious sounds there, so that's really good. Now I'm just going to listen with the bell, and with the bell we're just going to listen for more shallow sounds that we wouldn't usually hear with the diaphragm, and those same landmarks. Okay, great. So I didn't hear any adventitious sounds there. Everything sounds really good. You don't have any. Have you had any heart trouble, chest pain, anything like that?
No, ma'am.
Okay. And now you can find all of your. I'm just going to educate you on some places that you can find your heart rate. So you have a auxiliary pulse here, or yeah, a brachial pulse here, a radial pulse here, a femoral pulse here, popliteal here, dorsal pedis here, and a we'll go back to that one. Okay, so now I'm just going to listen to your lung sounds, okay? Okay, and with every new landmark, I just need you to take a deep breath in and let it out, okay? So we're in the upper right lobe, upper left lobe, middle left lobe, middle right lobe, lower right lobe, lower left lobe. Okay, and now I'm just going to listen to some on your back. So upper left lobe, upper right lobe, lower left lobe, and lower right lobe. Okay, great. So I didn't hear any adventitious sounds there. I didn't hear any crackling or stridor or anything like that. Have you noticed that you've had any excess mucus buildup or anything like that when you cough?
No.
Okay, and if you could cough into your elbow for me. Okay. I didn't assess that that was a productive cough, which means that you didn't have any mucus come up with that, which is expected because I didn't hear any sounds. I do just want to educate you on some good deep breathing exercises. So whenever you're like laying around watching TV, just make sure that like when a commercial comes on or something, try to do this at least 10 times an hour, but not consecutively, but take in some deep breaths and then hold it for about 5 to 10 seconds and then let it out. Can you demonstrate that for me? Okay, good. And you also want to turn cough and deep breathe when you're laying down flat or anything like that. So you just kind of want to roll around, that just helps break up any mucus that you might have in the lower part of your lungs to get it out so that pneumonia doesn't form. Okay, now we are just going to assess some range of motion in your extremities, okay? So if you could, we're just going to use the elbow. If you could, I'm just going to hold your joint and flex and extend your elbow for me. Did you have any pain there?
No.
Okay, and now could you do it with some resistance? Okay, and push down. Did you have any trouble there?
No.
Okay, and your wrist, we're going to do the same there. So flex, you're going to flex, extend, and hyperextend. Do you have any trouble there? Okay, and now with some resistance. Here you can go down and up. Any pain? Okay, we're just assessing to see if you have any crepitus or anything, which is just cracking or anything like that. Okay, so the same with this arm. Go up, flex, and extend your elbow. Okay, and here. Your wrist, flex, extend, and hyperextend. Okay, and now with some resistance. And up. Okay, and here, go up. Elbow up. Okay, good. And then now elbow down. Okay, great. You didn't have any pain there or anything?
No.
Okay, now if you could kind of lay back, I'm just going to listen to some bowel sounds, okay? So first I would pull her shirt up and inspect just to see that everything is normal and there aren't any lumps or bumps that I feel. Then I would listen and palpate afterwards so that I don't mess up my listening. I'm going to start in the lower part of your abdomen, which is the right lower quadrant, and just listen. So just try and be quiet. In the upper right quadrant, upper left quadrant, lower left quadrant. Okay, now I'm just going to listen to with the bell to see if I hear any bruits or anything like that. I'm also going to listen right up under the xiphoid process to see if you have any aortic abdomen sounds there, and there's nothing there. Alright, so your bowel sounds sound really well. Have you had any trouble with your bowels lately?
No.
When was your last bowel movement?
This morning.
Okay, did you notice that it was liquidy or was it normal, anything like that?
Normal.
Okay, and do you have any pain when urinating?
No.
No. Did you notice foul color, smell, or discoloring in your urine?
No.
Everything's normal there?
Yes.
Okay, great. So now we're just going to move down to your lower extremities. We're going to assess range of motion here as well. So if you could just and lower your knee. Now with, okay, resistance. Any trouble there? Okay, and we're just going to take your shoes off real quick. Okay, and if you could extend, hyperextend. Okay, no pain there or anything. Okay, and with this one. Okay, and now with resistance. Okay, and your knee. Okay, now with resistance. Okay, did you have any pain there or anything?
No.
Okay, now I'm just going to assess your pulses down here. If you could come up to the chair, feet flat on the floor. Your dorsal pedis is right here on the top of your foot. I'm just going to assess that they're both equal. You have a good, strong 2+, or about a normal 2+ pulse there. And this is your posterior tibialis. This is the one that I missed earlier. I'm just going to check to make sure you have a good pulse there. You have a good 2+ pulse there as well. And while I'm down here, I'm going to check for capillary refill in your toes. And this is just ensuring that your heart is able to, there's no, you have good blood flow down here because of your heart. And it returned back in less than 3 seconds, so that's really good. While I'm up here, I'm just going to check for I'm going to come back up here and check for skin turgor. That's just making sure you have good hydration of the skin. I'm going to check your hands here, check your capillary refill here as well. Everything looks good there. I'm going to check for edema. I don't feel any. While I'm here, I'm also going to check the temperature of your skin, and nothing seems off. The hair all looks evenly distributed. I'm also going to check for edema here, and I don't find any here. Temperature of the skin is very well there, and her toenails and all are very well intact. Now I also need you to stand up for me, and if you could, turn this way. Okay, and if you could just close your eyes and stand still for me. Okay, so that was the tandem test. We were just checking to make sure that you have good balance. Now, if you could, the Romberg test, we're going to, if you could take 5 steps forward. I'm just going to assess your gait and balance. Okay, and turn around and come back. All right, you can sit now. So that just shows that you have good gait and balance. Now, if you could, can you tell me your name?
Emily Myers.
And where are you at right now?
At the doctor's office.
And what are you getting?
A physical exam.
Can you tell me what year it is?
2021.
Okay, great. So that just means that you are aware ×4. So that means that you are aware of your surroundings, place, time, and person. So if you didn't know any of that, we would use the Glasgow Coma Scale, which helps us adequately assess for brain injury. And what we do there is we assess your motor response, verbal response, and eye-opening response. Any score less than 8, we would assume brain injury. A score 13 or above, we would assume mild to no brain injury at all. And I think that is all for us today. Do you have any questions?
No, ma'am.
All right, well, you did really well. I'll be sure to document all of my I need to assess your pulse real quick, okay? So I'm just gonna set my time here for 30 seconds. Just relax for me. All right, and now I'm just going to assess that your radial pulses are good and even. You have a 3 plus pulse in your radial region. Also, while I was checking your pulse, you had a pulse rate of 82 beats per minute and a respiratory rate of 12 breaths per minute, which is all within the normal range. Your breaths were also very even and unlabored, so that's really good. Okay, so do you have any questions?
No, ma'am.
Okay, great. Thank you. Have a good day. I would perform hand hygiene and pull the curtain back.